Assalamualaikum guys, my name is Mohammad Sadjan and welcome to my channel. This video is about anatomy of scapula, and if you are new to my channel, so please hit the subscribe button and give this video a big thumbs up. So without wasting any time, let's go. Okay, so here in this video you are going to learn about what is scapula, how many articulations does a scapula make, what is its anatomical location, what are its main functions, how many bony land markings are there on the scapula, and at last how to differentiate between the left and the right scapula. Scapula is a bone of upper limb, also known as shoulder blade, shoulder bone, wing blade or wing bone. Scapula is flat bone and it is triangular in shape. Scapula makes two articulations, one with the head of a humerus known as glenohumeral joint and another with the head of a clavicle known as acromioclavicular joint. Anatomically, scapula is located on posterior wall of thoracic cage or rib cage between rib number 2 and 7. Scapula covers almost half of the rib cage, as you can see here. Scapula's main function is that it connects the upper limb with the trunk of the body and it stabilizes shoulder motion, provide wide range of movement and mobility. Coming towards bony landmarks, scapula has three main surfaces: posterior surface, lateral surface, and interior or costal surface. Posterior surface of scapula contains three borders: medial border, lateral border, and superior border, and it contains three main angles: inferior angle, superior angle, and lateral angle. The yellow line shows the neck of a scapula. Posterior surface contains two fossae, infraspinous fossa and supraspinous fossa. Infraspinous fossa is a bit larger than supraspinous fossa. Both of these fossae are divided by a spine of a scapula. It itself contains acromion at its lateral side and deltoid tubercle at its medial side. There is a notch superior to spine known as suprascapular notch. On lateral surface, the most prominent structure is glenoid cavity. Its superior is supraglenoid tubercle and its inferior is infraglenoid tubercle. Coracoid process and lateral border are also visible on lateral surface. Costal surface of scapula faces the rib cage. It contains a large concave depression over most of its surface known as subscapular fossa. Borders, angles, and neck of scapula are also visible. You can also label the acromion of scapula on this surface. Coracoid process, that is a hook-like projection, can also be identified on this surface. Okay, so in order to determine if the scapula is right or left, all you have to do is to orient the scapula in such a way that its posterior surface faces towards you. Now, look at the glenoid cavity, faces laterally outward, and the spine is posterior and superior, and the coracoid process should be anterior and superior. Now look at the spine of a scapula. If its direction is from left to right and superior, so this is the right one. And if its direction is from right to left and superior, so this is the left one.